Joining me this afternoon for the Workforce Education and Labor Committee hearing this afternoon about the 2026 operating budget, which we affectionately refer to as the WELL Committee here around City Council. During this hearing, we'll review and consider the mayor's proposed 2026 operating budget as it relates to the city's Department of Human Resources, Civil Service Commission, and the Mayor's Office of Education. This committee is all about people. It's about how we're investing in our workforce here in Columbus, our employees literally at the City of Columbus who perform amazing services all across the city. As we have an impending snowstorm coming in, we think a lot about city services more now than ever when people are thinking about the folks that help to keep our community safe and well served. But also to make sure that our youngest members of our community, our kids, also have access to resources and investments to make sure that they and their families can be successful moving forward. I know we have a number of directors who are here today and some of their staff who has joined us who are deeply committed to their missions, and I appreciate them and their staff preparing for today's hearing. As the budget process continues to move through council, these hearings are an important opportunity for us to really review substantively with the directors and leadership within those departments of how their budget is proposed and how that may differ from previous years. This year is no secret that this budget is tighter in previous years with the reduction of federal support and state support to cities, not only here in Columbus, but across the country. Many communities find themselves in a position for the first time in a long time in which we're having to do far more with less. And I think as it relates to the investments that we make in these critical areas, we need to be very mindful of how do we operate in an environment in which, again, it's more difficult now than it ever has been to service our residents, but also ensure that we're investing in our workforce here at the city. So with that, we would love to sort of get things going. We do have a number of public speakers, which I'll be calling up at the end after all the presentations. So first, we'll have Director Matt Smito from the Office of Education to review their 2026 budget. Director Smito, the floor is yours.
Thank you, President Pro Tem. President Pro Tem Dorans, thank you for providing us the opportunity to present to you our proposed budget for 2026 fiscal year. I'll start over, sorry. Sorry about that. It's like I've never done this before, thank you. President Pro Tem Dorans, thank you for providing the Mayor's Office of Education the opportunity to present to you today the Office of Education's proposed 2026 operating budget. That's how I hope to walk out of here today. And just remember, I like to use pictures of our kids in the program. Every picture in here, except for one, are pictures of the kids in our programs. These are our kids. So I'd like to first walk council through some of our successes from 2025, starting with our flagship program, Early Start Columbus. In 2025, which is school year 25-26, our current school year, we are serving more children than we ever have before, and with less money than we spent to serve even less kids in the previous school year. And we continue to make progress in preparing our kids for kindergarten. As you know, the Kindergarten Readiness Assessment, or the KRA, is our North Star, as it is the best indicator of a child's success in school and in life. During the 24-25 school year, the number of Early Start Columbus kids who tested in the top band increased by over 3 percentage points. And as you can see, these numbers greatly exceed the percentages in both Franklin County and the state of Ohio. And the number of children who tested in the lowest band decreased by 3 percentage points also. But much more work needs to be done in this area. As our chair knows well, we are already failing the kids who test in the lowest band. Evidence shows that kids who test in this band will not succeed. That is why we recently implemented a mid-year assessment and intervention plan to catch these kids and to catch them up before it's too late. Another office success is our after-school program for middle school students. Again, kids in our program. Look how much fun they're having. This year, we rebranded the programs as Ames Columbus, After School Initiative Middle School, and we released our impact report from last school year. Here are some statements from both youth and from providers in the program. Youth in our programs experience 12-point gains in social emotional development and an 83% satisfaction rate. We served over 1,350 unique youth in almost 6,100 hours of programming. And a couple more statements, both from students in the program and from the providers. Ames worked with 28 organizations who operated 42 after-school sites. As part of Ames, we also host monthly learning collaborative trainings for our providers with an average attendance of 50 people per session. Some of those topics of those trainings included de-escalation strategies, restorative practices, developing resilient relationships with youth, effective partnerships, Operation Street Smart, and program sustainability. We also have monthly, less formal coffee and conversations, which are more organic and free-flowing. Okay, back to early education, life at the Hilltop Early Learning Center. When we designed this center, we really wanted to be an asset that would serve the unique needs of all of our children. And it is. Currently, we are serving 154 children from the Hilltop in 10 classrooms. And at the on-site Nationwide Children's Hospital Health Clinic, 578 children receive primary care services, 414 children receive vaccines, and 225 children receive dental services. We know that children cannot learn and they cannot develop if they are not well. Like just a quick clarification on the math here in case you're adding this up. Since 154 kids go, and we've seen so many, kids are seen numerous times, and then also kids from a couple of the nearby elementary schools come over to be seen at the clinic by Nationwide Children's Hospital as well. I'd like to give a huge shout out to Columbus Early Learning Centers, who has served as the master operator of the center for the last 3 years. They take care of their families. I just took this picture yesterday and I had to add it to the deck real quick, so thanks to your staff for allowing me to do that. They take care of their families. They send a bag of food home with every family every week, and they do this at all 5 of their centers. And I'm very excited to provide you with some results of our investment in Future Ready 5, our education-focused public-private partnership. Through their targeted kindergarten readiness cohorts, Future Ready partners with early education providers to increase the reading skills of children enrolled in their centers. As you can see, Future Ready helped increase the number of children who read above average by 20% and decrease the number of children who read below average by 30%. One of my favorite programs is Safety City. This is a partnership with Nationwide Children's Hospital where children learn about basic safety protocols. Children learn things such as fire safety, stranger danger, firearm safety, what not to eat, and many other topics. The past summer, 345 children participated at Safety City, held at six different locations during the summer. And if you're wondering if it works, it does. Post-assessment data shows that children not only learned, but were able to perform correctly in specific dangerous scenarios. All right, we'll stop patting ourselves on the back now and walk you through where we are, what we are proposing for 2026. But again, look at this picture. I mean, that's what we're bringing. Our proposed budget for 2026 is $12,454,747. And just a reminder, we're only doing this with 2 of us. Oops. This represents a reduction over $1 million from last year. So how will we handle this? I loved Bruce Lee as a kid. We'll be okay. A quick look at our request for 2026 shows that it is $1.012 million less than our target from this year, and $1.2 million less than last year's budget. Oops. Sorry. So what happened? A quick look at our administration shows that we moved $377,000 out of the administration line. Where did it go? For cupcakes and spa days, obviously, but realistically. A quick look at our grants section shows that some of the funding went here, This was just moving funding to a different funding code. Our after-school funding remains unchanged. Taking a quick look at our early education funding, by far the biggest part of our budget, we can see that our appropriation for the Hilltop was decreased by $1 million. And while we have done amazing work at the Hilltop Center, we have yet to reach full capacity. Our appropriation for Ready for Success was decreased slightly. Our funding for Future Ready remains unchanged. Funding for C-Hive, our student data portal, increased by 5%. Partnership for Success is the same as previous years. Importantly, our Early Start Columbus funding remains unchanged. Sorry, let me go back. We took some money from our secondary Early Start line, and with some funding saved from Ready for Success, which was reduced this year, we funded a new kindergarten readiness cohort of Future Ready 5. Thank you for your consideration of the Office of Education's proposed 2026 budget. And thank you to City Council, especially to our chair, President Pro Tem Dorans, and his team for all the support you have provided us. We never would have been able to do what we have done without your assistance. I have just a couple more slides real quick. I mean, look at that. I know. That's the one that's not ours. Thank you.
Thank you, Director, and apologies to Director Shea and Martin. You're not going to beat Director Smido on your presentations with the cuteness here today, so.
Or number of slides.
Yeah, don't even try. So thank you, Director. I appreciate the presentation. Just a couple of questions, and, obviously as a parent of a 5-year-old, the work that you all do speaks to me personally and so many parents across our community about, the investments that we make in our kids at such an early age pay, just a cascading amount of dividends for them for their, social, emotional, and educational supports as they continue to grow. So thank you for your work. So the first question I have for you is one that you stated, but I want you to say it out loud again. How many people are in your office doing all this work?
Oh, President Pro Tem, thank you. 2. We have 2 FTEs.
So again, when we're talking about it being sort of a leaner budget, your office is doing all this work with literally 2 people. I just think that's something to be highlighted and commended, that you all have been able to have an incredibly outsized impact on the community given the amount of personnel that you actually have in your office. So not really a question, but just something I wanted to throw out there for you. I know when we look at the numbers of how we fund early childhood here in Columbus, you take a very unique approach on how to make sure those funds go as far as possible. So I was wondering if you could walk through, from an investment standpoint, sort of the approach of the office and how to make sure that these very finite amount of dollars make the biggest impact from your office.
President Pro Tem Dorans, thank you so much for that question. Yeah, we have a unique approach, and it has been the same for 11 years, and actually we changed it this year. We had certain categories depending on the level of step up to quality rating, which is the state's, as you know, the state's quality and improvement system rating. And we braid that with state subsidies, publicly funded child care Title 20 funds, and their ECE grant, and a couple other ones. Our goal is to make sure that every provider gets at least $10,000, because that's what we feel
Per child.
Per child, yes, is the cost of a quality education. This year, we did change it a little bit because of some changes that the state made to public funded child care braiding, how they allow organizations and entities to braid that funding. So we did change it a little bit each year, and that's really what allowed us to greatly increase the number by almost 100 kids this year that we're able to serve. But we're still seeing those same successes. So, but it's a method we've always used to most efficiently use city money, is that we braid it with other funding sources, using city dollars as last dollar in, oftentimes just giving them a small amount of money on top of some of the other funding sources that they've already received.
Thank you. You mentioned the Hilltop Early Learning Center is sort of a unique situation where the city built a world-class facility in a childcare desert, essentially. And we have a private operator, Columbus Early Learning, that's there. Could you talk a little bit about how that partnership has evolved and sort of the budgetary implications of that for you all when the city spent capital budget dollars to bring this amazing facility out of the ground, and with having a private operator there, and you mentioned that it's still not at full capacity, and sort of how that has changed throughout the years since that's opened?
President Pro Tem Dorans, thank you. Yes. Gosh, I mean, I think we've been working on this thing for 6 or 7 years now. It opened its doors about 3 years ago. The design phase took a long time because we had a lot of investigation into what our kids needed, especially poor kids who live in the greater Hilltop area, what they need to succeed. Because of that, we really did made it a state-of-the-art place. And in fact, we have so many stories of when families brought their young children, their 4-year-olds there for the first time on the first day of school. They had older siblings trailing with them who were enrolled in elementary school or middle school, and we had some testimony saying, these older kids said, can we go here? This place is so nice, indoor, outdoor playground, full kitchen. But one of the greatest things to me is that full medical suite by Nationwide Children's Hospital. So these kids can get their immediate medical, mental, dental issues taken care of immediately. They're screened and they receive immediate backup care. But it has evolved, and last year we added an infant toddler room for longitudinal work in education. We have partnered with Columbus Early Learning Centers, who have 4 other centers spread around the city. They bid on this. 4 years ago, we sent out an RFP, and we had 4 organizations apply, and we chose Columbus Early Learning Centers. Through our contract with them, they are only allowed to operate 4 classrooms in the center. So there are other entities that operate classrooms in there, subcontracted from Columbus Early Learning Centers. It's YMCA and CDC Head Start operate in there as well. They pay us rent to be in that building, and then we pay them a certain amount per pupil. If we were at full capacity, it would be about $3.12 million, which is generally is my appropriation, has been in my appropriation, but it again is $1 million less this year. And I think this speaks a lot, President Pro Tem, and as you know, from, we talk a lot, that childcare and early education is struggling. It's a fragile industry, and has been well before the pandemic. It has not fully recovered from the pandemic, but these are programs, especially for our children, our low-income children, disadvantaged children. The families can't afford the tuition that a family like mine paid to send my children to a child care center. So they survive on state subsidies, which are much, much less than they would receive if they had a family paying tuition. Teachers are paid barely livable wages, and then sometimes not livable wages. Most oftentimes, too, they don't receive health care or any of the other type of benefits that most employees make. So even though it is a beautiful place, and they pay their teachers in perspective well, it is hard for them to recruit teachers. So they, often the challenge, and in working with Action for Children, and they do surveys of all child care providers licensed in Franklin County, and they say, what are your barriers? And it's always, I don't have enough teachers. Like, I could open 1 more classroom if I could get 2 more teachers. But our teachers are going other places where they could get a higher wage, whether it be Amazon or Walmart or Target or another retailer like that. Our child care centers cannot compete. We've made progress, though. I mean, I think last year they had just hit 10 classrooms at the end of the year, but I think our first year they started out with 5 classrooms and made it up to 7. So, I'm confident that we will hit full capacity at some point, but, they are struggling to enroll kids because they don't have enough teachers.
Yeah, thank you. Appreciate that. I don't have any additional questions, but I will just have you on call because I know we've got a couple public speakers, so I'll ask all the directors if they have any comments they want to make after those speakers to sort of jump on in. So thank you for the presentation. Next, we have the Civil Service Commission with Director Shea. Floor is yours.
Thank you. Good afternoon, President Pro Tem Dorans. Thank you again for the opportunity to speak on behalf of the Civil Service Commission today. I am joined by the Commission's Deputy Director, Beth Bailey, and we've worked on this presentation together. We thought today that it would be prudent to start with a very brief overview of what civil service is and why we exist. Because understanding the why is going to help to inform today's conversation about the resources that we need for our day-to-day operations. And I don't have any fun photos, as you mentioned. I have some clips of the different legal documents instead that we are beholden to. But the Civil Service Commission, or commissions in general, were instituted in Ohio in 1913. And while I am sure that the structures and practices have changed over the past 100 years, the overall purpose of civil service has not. Civil service exists to provide guardrails against nepotism, and it establishes merit-based processes that are for creating, filling, and maintaining the city's classified jobs. All of our responsibilities stem from law or regulations, from the city charter and Ohio Revised Code to requirements imposed by the State Personnel Board of Review. Our commission ensures that all city employees are best suited for their work to meet the expectations of our customers, which are the residents of our city. So in order to meet these expectations and maintain the same level of service, the Commission's budget proposal for 2026 is $6,653,809. And before highlighting some of the notable items in our proposal, I would like to briefly outline the key considerations that informed the development of our proposal. So once Civil Service received its target allocation and began developing our plan, it became very clear quickly that the amount that we received would not fully support all of the identified priorities and operational needs. As a result, we were required to close the gap of approximately $500,000 between what we as a commission had initially planned and the target amount that was provided. This gap was ultimately addressed through strategic resource alignment and the decision to defer or eliminate certain planned initiatives or expansions. Now, following submission of our proposed target to the Department of Finance, our total amount was further adjusted during that review process and reduced by an additional $137,917. So accordingly, the total budget number that you see up on this slide today reflects not necessarily where we began, but where we ultimately landed after all of the necessary adjustments. And it certainly doesn't include a request for any additional funding from this council. Rather, we do feel confident that even with the adjustments that we've made, we will still be able to maintain a consistent high level of service. Again, in looking at the chart that is on the slide, I'd like to highlight a few areas. Overall, the Commission was able to reduce costs across all areas with the exception of personnel. However, we expect this considering all of our work is significantly staff dependent, which is why our personnel costs are 84% of our budget overall. And I'd like to just use an example. The Charter, Section 153, payroll certification, it doesn't cost us anything in services or materials and supplies to perform this service. It is solely done by staff. However, if this process didn't occur, we would not be able to verify to the city auditor that all of our city employees have been appointed in accordance with the Civil Service Commission provisions of the Charter and paid in accordance with the applicable salary ordinances, thus resulting in Charter and rule violations as well as potential holdup on paychecks. Our proposed personnel costs did increase by 5% from 2025. This increase reflects the addition of one, perhaps two new hired employees, as well as rising personnel-related costs that are out of our control. For example, increasing costs seen in the insurance world, the amount of costs for each service. The other area I would like to highlight is in our services line, and while we were able to make reductions in that area, I did want to point out that the commission has a statutory responsibility to ensure that our pre-employment medical and psychological assessments are conducted for police officer and firefighter applicants. The commission is responsible for ensuring that these assessments are completed and are in compliance with the applicable law and pension requirements, as well as covering the associated costs. So aside from personnel, that services line is the commission's next largest budgeted cost. However, we were still able to make reductions, and we were still able to make reductions from the monies allocated towards those medical and psychological assessments. We made modest reductions in that area based on realistic use projections with the goal of maintaining a conservative estimate. However, I do want to point out that with that evaluation, we had to balance that with the need to issue a new RFP for a medical contract, and we're hoping that we will get that RFP out in the first quarter of this year. The reason I say we have to balance that is that at this time, costs for that contract are unknown because the current medical provider has closed its location. So we know going into this, we're going to have a brand new medical provider we may not have had history with. And so we're unsure of what their cost proposals will be. And on top of that, the new medical provider is going to be asked to share costs with updating the commission's medical standards for police officer and firefighter applicants, as those have not been wholly revised since 1992. And then just one final highlight is that the commission is still committed to supporting the EDGE program. And EDGE stands for Empowering Development by Gaining Employment, and it's a program designed for restored citizens of Central Ohio, which is one of Ohio's most underserved populations. This program provides participants with education and skills related to work readiness and job preparation, as well as specialized occupation services and supportive wraparound services leading to sustainable employment. And this program, I know, is supported by the city. It is a program through Alvis, but it is also important to the commission because it closely aligns with our purpose. It is our purpose to ensure that everyone has fair and equal access to city job opportunities that are based on merit system principles. And we believe that the contribution to the EDGE program helps align our purpose with the purpose of that program. And on my final slide, I want to mention, especially because we chose not to necessarily go back and reflect much on 2025, but rather talk about, our proposal for this year and what also we would do this year that will inform us for next year and in years to come. And that's that we're going to continue with the first phase of our civil service modernization project. This phase focuses on internal and external research and benchmarking, a comprehensive assessment and consultation with a contracted subject matter expert, and the development of formal recommendations and a report. So the outcomes provided in this assessment to the commission will be clear, data-driven. It'll be a roadmap for long-term direction and future improvements with the hopes of reducing any risk of inefficient or misaligned systems and ensure that the future funding decisions for 2027 and beyond are both informed and fiscally responsible. Again, thank you for the opportunity to speak today. This concludes my portion of the slides, and I would be happy to answer any questions that you have.
Thank you, Director. One question sort of, again, in the end of your presentation, talked about those modernization efforts. I know that has been something that has been of a lot of interest, just making sure that the city maintains a merit-based employment system, while at the same time recognizing that it is very much the 21st century and getting qualified candidates in the door as quickly as we can to make sure they go from a candidate to someone who's hired and, in the job, and that happens as quickly as possible. I know that is something that is of your interest when you talk about those modernization efforts, to think about how are we doing that compared to other cities? What are the supports that are needed to move that through? Obviously, there's a budget implication for those efforts. So you could talk a little bit about sort of what that looks like for you all this year when you're thinking through what those studies look like. Is that going to be folks doing that work in-house? Is that bringing folks on externally? Sort of how are you going to approach that, and what, if any, sort of budget implications that has for you all?
Yes, absolutely. Thank you, President Pro Tem. We were able to plan ahead a bit, and we, through the Department of Technology's contract, it's their OST contract, where they, I believe it's through the state, and they have partnered with us to help us jump on, I guess, their legislation, to where we have already legislated, set money aside from our 2025 budget to help with that process this year in 2026. And so we are going to use those funds to pay the individual that we contract with through this process. We just finished up interviews this week, and I do believe we have a very qualified candidate with a public service and civil service specific experience. So I, at the moment, don't see any immediate costs. I think that there are some costs that we could potentially see at the end of the end of this contractor's analysis and reporting, but we're not sure yet at this point. What I can say is the initial costs and the budget to pay for this individual has already been allocated through 2025.
Okay. You mentioned the EDGE program, which is something, I think you and I have been at many of the graduation ceremonies together. It's literally one of the happiest days in City Hall, seeing those graduates with their families. Obviously very excited to see that remain in the budget in a very tight year. That funding is about the same as it has been for a number of years. Is that correct?
So it is to some extent, and I say that because I think like pre-COVID, we saw approximately $200,000 in grants. And then once I came onto the commission and we saw post-COVID, 1 year it was increased to $300,000, and we have stuck with that $300,000. Again, we were able to plan ahead a bit with some funding in our budget for 2025. So I can confirm that $300,000 for this year is already allocated partially from 2025 to pay that $300,000 grant as well. And our goal is if we can future think as much as possible to try and get ahead of it versus trying to find costs at the end or money at the end. That's how we look at the budget in order to make sure that grant goes out.
Okay. Fair to say, based on that answer, I think a couple of the other things that we've talked about with your department, some of the things that are happening in 2026, were actually accounted for from a budgetary standpoint in prior years. So while there's a lot of activity going on right now, from a budget implication standpoint, again, you're lower than you were last year. And again, when we're looking at, again, some of the activities that are happening, those were budgeted for in prior years. Is that generally fair?
It's generally fair. I will say, again, as I've been in this position officially now for just a little over a year, and my deputy director has been in the position for about 8 months, we went into this budgeting season with some plans for expansion. We know that while our workload and the amount of services being requested or the applicants that we're processing continue to increase year after year, our FTE numbers have remained steady in the low to mid 40s. Ideally, we also had an idea, to expand in the community relations area. However, due to the budget this year, we weren't able to do that. So some of those plans are simply on hold. But overall, you're right that the main and important pieces of our budget and the commission services are accounted for in this proposal.
Okay, thank you. Any other comments?
No, just thank you for your time. We appreciate it.
Appreciate it, Director. Next, we have Director Martin for the Department of Human Resources. Director, floor is yours.
Good afternoon, President Pro Tem Dorans and colleagues. It is my honor to be here representing the Department of Human Resources and presenting its 2026 operating budget. I am joined today by my Deputy Director, Vinitha Jose, and Fiscal Manager, Jenny Hill. I want to also thank my Fiscal Manager, Josh Davis, who cannot be here today, but put in a lot of time and effort to get this budget complete, as well as our department leaders who helped us also. Okay, here we go. So I'd like to start by giving a brief highlight of the department's 2025 accomplishments, as many of these have paved the way for this year's budget and goals. The first are our modernization efforts. We kicked off 2025 with the Dayforce expansion project in collaboration with the Department of Technology and the Auditor's Office. And we are starting our efforts with learning management and performance management, and this is also carrying over into 2026. Additionally, we created the employee roadmap with input from citywide HR officers. This is a blueprint for the City of Columbus employee experience, which you can see up here on the screen. It starts at how the city presents to the community and moves all the way through the employee's final days of employment. This year, we are continuing these efforts. We're starting with a deep dive into citywide onboarding practices. Last year, we also began work creating the Citywide Occupational Safety and Health Administration, also known as COSHA. Effective January 1st of this year, COSHA is officially a division within the Department of Human Resources. This required code changes to Chapter 168 and 169, as well as the creation of several new classifications, including the Occupational Safety and Health Administrator, Workers' Compensation Claims Examiners 1 and 2, Workers' Compensation Hearing Representative, and Workers' Compensation Manager. We also expanded in our department and hired several new hires. We have a new HR analyst, an executive assistant to the director, an additional deputy director, 2 employee benefits analysts, an industrial hygienist, and a new position, employee communications and engagement specialist, who focuses on internal communications. We also began working with our new vendors, Marsh McLennan Agency, which is the city's new healthcare consultant, Ohio Health, which will handle the contractually mandated testing for police and fire, Anthem, which is the city's new insurance vendor that goes into effect February 1st, and CVS Caremark, which is our new pharmacy vendor that goes into effect February 1st as well. On the leadership front, 2 of our citywide training and development employees are now certified executive and leadership development coaches. These employees are now available to all citywide employees who are interested in expanding their experience in strategic thinking, communication, and team building skills to be better leaders. We also held several events last year, just to name a few. The Career and Resource Fair. This was in partnership with Columbus Rec and Parks, where we invited Columbus residents to learn about city employment and apply for job opportunities on site. We held our annual Employee Health and Benefits Fair, which was also a partnership with Columbus Rec and Parks, as we moved the event from the downtown campus to the Berliner Athletic Complex, which allowed us to comfortably serve more employees and host our vendors. We held 2 events at the National Veterans Memorial Museum, the 9/11 Remembrance Ceremony and the Veterans Luncheon. And then we also held our annual Human Resources Conference, which is a citywide conference for HR personnel held at Columbus State Community College. And then lastly, we worked with finance and management to enhance security efforts at 77 North Front Street. These enhancements included metal detectors at the entrance of 77, as well as additional badge readers on the first floor and a more accessible panic button in the hearing room. With these efforts, our 2025 budget was well spent, and there are 2 overarching themes that were launched and we will continue to expand upon in 2026, and that is the employee and candidate experience as well as modernization. This brings me to our proposed operating budget for 2026. At the end of 2025, we evaluated unnecessary expenses, including a more intentional approach to hiring, where hiring requests are filtered through the chief of staff. We limited training and travel expenses in the department to those required for licensure. We also paused the approval of additional technology and subscriptions, and we did not provide our usual swag for the HR conference. These efforts have better positioned the department for financial stability in 2026 and are reflected in our budget proposal. So as you can see here, the department's overall proposed budget for 2026 totals $14,129,655. This comprised of the general fund and the employee benefits fund, $4,286,037 coming from the general fund, and $9,843,618 coming from the employee benefits fund to support increased costs associated with four key things: public safety, health, and physical fitness testing, additional personnel, further development of CACD, and lastly, we are respectfully requesting an expansion position. So to dive more into reasons for these increases, FOP and IAFF testing, our police and fire testing, are contractually mandated. The city is contractually mandated to administer a physical fitness test for these groups, and we've been granted an unfunded request to cover the majority of the testing. The primary reason for the increase is we have a new vendor. For at least 10 years, probably closer to 15 years, the city has been contracted with Mount Carmel, and effective last year, we are now working with Ohio Health. And in this transition, we have, it's been brought to our attention that there were several services that Mount Carmel just was not charging the city for because of that longstanding relationship that we are now paying for with Ohio Health. When it comes to personnel, we have hired 7 new employees in 2025, which I previously mentioned, and our department continues to grow. The Columbus Advisory Commission on Disability Issues, also known as CACD, was codified in June of 2025 to advise the mayor's office, city council, and city departments on policies, programs, and services that affect individuals with disabilities. In 2026, we will be expanding those efforts, starting with departments Departments will be invited to present on how they are addressing accessibility throughout 2026. And then lastly, our expansion position, we are requesting a performance management analyst 2. This position will focus primarily on performance management as a part of the ongoing strategic roadmap initiative. The Department of Human Resources has been tasked with integrating performance management and compensation, and the strategic roadmap spells out operations and culture as a strategic priority for both 2025 and 2026 that will ultimately improve the employee experience. In addition to the expansion of Dayforce utilization, performance management, and performance-based pay, which I will discuss on my last slide, this position will help align our work and the budget to enhance HR operations and citywide culture. This position will also integrate performance management systems for a more standardized and comprehensive approach, thus eliminating an antiquated paper-based program to realize operational efficiencies. This is another priority that will utilize performance management functions in Dayforce, enabling the cancellation of software contract that would be a redundant system. Lastly, I'd like to introduce our 2026 department goals. Our proposed budget will give us exactly what we need to continue operations and follow through on the following department goals. First is our HR system optimization. Citywide training and development and the compensation sections are working with our Deputy Director, Deputy Director Vinitha Jose, as well as the Department of Technology and the Auditor's Office to integrate current systems and practices into Dayforce. The learning management and performance management system implemented and used in Dayforce, our goal is to have that implemented by the end of 2026. Next is our wellness strategy. The effort in 2026 is to align our programming into an enhanced wellness strategy that is more intentional about driving engagement and promoting healthy outcomes. While traditionally owned by Employee Benefits and Wellness, our hope is that this will become a cross-functional effort amongst several of our sections in HR. And then lastly, the candidate and employee experience. This is an effort focused on the employee experience across the city from the employer's perspective. So as you can see, in 2025, we created the employee roadmap. This year, we are focusing first on onboarding across the city, hoping to streamline that. We are also looking at this employee's full first year with the city, and we are looking at how we can have supporting roles in delivering standard compensation as well as HR practices such as performance and leave management in this process. Ultimately, the goal is to streamline and simplify the hiring process across the city. By using standardized HR efforts, we can ensure more touch points with new hires, enhancing the first-year experience with the city. As an internal-facing department, this work is how the Department of Human Resources makes a positive impact on the community. And with this budget, we can continue to strive for two things: a workplace where our employees are fulfilled in their work, and the city as an attractive employer for the future workforce. Thank you for your time.
Thank you, Director. And I want to thank you as well. This is your first budget hearing, so thanks for jumping in, both feet in. I
Thank
appreciate
you.
that.
Day 3.
And appreciate the presentation. Just a couple of questions. Again, with this being a budget hearing, most of them are sort of fiscally focused or have some lens towards that. Could you, again, pull all the way back out? This is, there's a couple of different departments of the city that are somewhat unique in the way that they're funded, and Human Resources, one of those when you talk about general revenue dollars versus the Employee Benefits Fund. Could you just talk about the distinction between the two of them, since we've got
Yes.
two big buckets of dollars that are going into, just so that folks, if they're tuning in, can understand sort of where those dollars are coming from?
Yes, so we are funded by two funds in the Department of HR, the General Fund and the Employee Benefits Fund. Many of our positions and services are split funded between the two. The Employee Benefits Fund has a chargeback model, so all of the money is essentially coming from the general fund. Give me 1 second and I can explain. Let's see. I apologize. I have my notes somewhere. There we go. So out of the Employee Benefits Fund, we cover our wellness initiatives, personnel, any labor relations costs. So for instance, this year, there's an increase to the Employee Benefits and Wellness Fund due to having several of our contracts expire and we're moving into negotiations. And then also our occupational safety and health clinic.
Thank you. And you mentioned the change between Mount Carmel and Ohio Health, and that there was a budgetary implication for that, given there were some services that Mount Carmel was providing that were not accounted for or there were additional costs anyways when we moved providers. Can you talk a little bit about that transition, sort of why that occurred?
Correct, or yes. So we shifted from Mount Carmel to Ohio Health due to an RFP process. And we had a longstanding relationship with Mount Carmel. And so when we were in contract negotiations with Ohio Health, there were just services that we didn't realize we were not paying for with Mount Carmel because of the tenured relationship. We are now paying for those services with Ohio Health, and so we are making adjustments accordingly.
Thank you. So one of the things when you talked about the new COSHA division, so this is something that I think the department's very proud of finally having that kind of division within it, really focused on employee safety. You just talk a little bit about this is news for at least the way that was codified and to being an actual division, but it's not new in the sense of the activities that are happening there, right? So from a budgetary standpoint, you can see sort of from a line item standpoint, it's now sort of broken out differently, but a lot of those activities were already accounted for in prior budgets. Is that correct?
That is correct. I would say the only change to their budget is testing, the mandated testing for police and fire, and that's just due to rising healthcare costs in general, and that's switching carriers or providers. But for the most part, all of the services that are offered through COSHA and programming are the same services and programs that they were offering under when it was occupational safety and health programs and not the administration.
Thanks. I always like to sort of focus on that when we talk about creating something new. The expectation is that there's new funding that has to
New.
go to it. And here it's more,
Nope.
from my vantage point at least, making sure those activities are under one umbrella rather than being spread out in a bunch of different places. And while
Yes.
to your point, there is a cost towards that one individual item. It's not as if, the department invented an entirely new division and now has, hundreds of thousands of dollars of new costs associated with that.
Yes, that's correct. It's the same employees. A few of them have new titles, but they're doing the same work.
Can you talk a little bit about, when we look at, the rising cost of healthcare generally across this country? We have, a federal government at this point that is seemingly absent from wanting to make things more affordable in the marketplace for whether or not you are a public employee or a private employee and just for the healthcare system generally. But that has real implications for us here in Columbus. So can you talk a little bit about sort of the expectation of when you're working with the consultants that we have that are working with our health insurance, just really about what this is going to mean from a city standpoint of the expectation of just higher healthcare costs generally, but then it also means higher costs for you all as you're figuring out working with different providers, not only for the plans themselves, but also the consultants that help you navigate a very, very, very complicated and very expensive healthcare environment.
Yes. So the city is obviously very aware of where healthcare is going and where we are right now. Our fiscal manager, Jenny Hill, who's sitting right behind me, actually manages the Employee Benefits Fund and has been working diligently with our Employee Benefits and Wellness Manager, as well as our consultants, MMA, to find unique ways to address these rising healthcare costs without that increase transitioning over to burden the employees. So while we do not have our rates yet for this year, we are working on ways to still stay competitive. So right now, I'm not sure if you're aware of this or not, but the city does offer a pretty robust health insurance plan, and we want to keep it that way. And so we have ways to reduce costs in some areas so that overall there's not a burden to employees, but there's going to be an increase. It's just we don't know what it is, and we are working to minimize it.
Thank you. I think that's one of the difficult things when we talk about having a budget. And when you have one of the central things that this department works on, it's a number that is hard to peg, given literally every single day something seems to change that may have a direct impact on whether or not what the budget implications are for us and fundamentally our employees, because we want to make sure that as an employer, as the city, that we're offering quality benefits and not overburdening our employees and their families with healthcare costs. But given the environment we're in, it's just getting harder and harder and harder to do that.
And I do want to point out that this is also one of the reasons why we're transitioning vendors to Anthem. When we went through the RFP process, Anthem is just offering a lot more services. They have a much larger network. And so with this change, it's one of the ways that we are managing healthcare costs.
Thank you. Finally, this is a contract year for our friends in organized labor, our bargaining units with ASME, CWA, FOP, and IAFF.
Yep.
What from your department, this is the department that leads those negotiations and ultimately is working with both, the mayor's office and eventually those contracts come to council. Generally the cost as those things get negotiated is with, both a consultant that assists with the negotiations and from a law firm that also helps to lead them. Those costs have stayed relatively stable over the years. There's, while we've had a change of which law firms are assisting us with those negotiations, those costs have stayed relatively flat, at least from my review from prior years. Is that fair?
Yes, that is correct. So while there is an increase in our budget this year, it's purely because it's a huge negotiation year for us and not because there are any significant changes to specific costs.
Okay, thank you. Well, thank you and congratulations on surviving your first Columbus City Council budget hearing.
Thank you.
And again, I want to thank all the directors, and before I get to the public speakers again, a focus on this being a different budget, and I appreciate all of them pointing out where their departments have looked to tighten their belt while also providing both support to our folks here internally at the city, but to also our residents across Columbus. It's difficult to do both at the same time, and I appreciate that we've got leaders here within the administration that are really focused on doing both those very difficult tasks at the same time. So, there's going to be additional hearings to come forward, and we're get to final budget here in the coming weeks, and just appreciate folks' hard work to get to this place. As I mentioned earlier, we do have 2 public speakers sign up to speak on topics related to these budgets. So the first we have is Mr. Andrew Robinson, CEO of Communities and Schools. Mr. Robinson, welcome back to council, sir. Good to see you again.
Good to see you too. Good afternoon, Chair Dorrance. My name is Adero Robinson, CEO of Communities and Schools of Ohio. Our mission is to surround students with a community of support so they can stay in school and achieve in life. Thank you for the opportunity to provide testimony in support of Communities and Schools, or CIS, and our request for a $150,000 budget appropriation to deliver comprehensive, evidence-based student supports. CIS partners with 46 K-12 schools across 6 cities in Ohio. Our full-time site coordinators work inside schools to deliver 3 tiers of integrated supports, from school-wide prevention to intensive one-on-one case management, addressing attendance, academics, behavior, and family engagement. This year, CIS operates in 29 Central Ohio schools, including 9 Columbus City schools. Last year, we partnered with 33 schools and served more than 16,000 students and provided individualized case management to over 1,900 students. Last year, in partnership with 11 Columbus City schools, we delivered more than 58,000 targeted supports. And among our case managed students, 96% of them graduated, 80% met or made progress towards their attendance goals, 88% towards their behavior goals, and 75% towards their academic goals. These outcomes are very important given Ohio's chronic absenteeism crisis. Missing 10% or more of school now affects over 1 in 4 students across the state. In our Central Ohio partner districts, those absenteeism rates range from 31% to 52%. Each chronically absent student costs districts an estimated $7,000 to $14,000 annually through lost instructional value, added interventions, and long-term risk. Reducing absenteeism for just 10 students can save districts up to $140,000. City of Columbus funding would help sustain 9 full-time site coordinators and provide critical resources to address barriers like transportation, housing instability, food insecurity, and mental health needs. This investment is also transformational for students like, I'll give you an example, Mark, who was a middle school student, who reduced his absenteeism rates from 32 days to 8, and raised his GPA from less than 1.0 to a 3.0 with CIS support. So I respectfully request your support for a $150,000 budget amendment. As I said, this funding would provide school-wide supports to more than 4,500 students and intensive case management to over 600, delivering strong outcomes, cost savings, and long-term benefits for our community. Thank you for your time and consideration. I can answer any questions.
No, thank you, sir. And I appreciate everything that you and your organization has done for our kids. I know my office has that amendment request, and this one we're really working through the process right now to see how we can identify some funding to be of assistance. So, our kids have always needed these supports, but we know how important it has been, particularly post-pandemic, just to make sure on that absenteeism is so key. Just getting kids in the classroom and keeping them there with the right support is so key, and you all have done just a magnificent job in making that happen. So I appreciate all the work from you and your team, and we are taking that amendment and seeing how we can make it work. So thank you.
Thank you. We appreciate that.
Appreciate it.
Enjoy the rest of your day.
Thanks, you too. Our last public speakers come for this committee is Dr. Vanessa Turney and Aaron Arnett, representing Future Ready 5. Welcome back to council. Good to see you both.
Good afternoon. Good to see you again.
Yeah.
Thank you, Matt, for the cue up to this conversation. We'll try to keep it brief. My name is Erin Arnett. I'm Director of Development at Future Ready 5, a nonprofit here in the Central Ohio area, working every day to transform early learning and achieve educational equity. How we do this is through our Kindergarten Readiness Collaborative, or the KRC, which partners directly with early childhood educators and education centers, serving our region's most under-resourced families. We currently focus on the 10 zip codes in Central Ohio with the largest gaps in kindergarten readiness, including communities like Linden, Whitehall, Reynoldsburg, and Groveport. Our work is not one size fits all. Like each of you in this room, we all learn and develop in unique ways, motivated by different factors. Think of yourself, your children, your employees. They each require different supports and encouragements. None of them are the same as our students that we work with. We assess children's literacy and readiness 2 to 3 times per year, which Vanessa will share more about. We provide ongoing coaching, in-person training, and data support for teachers and centers. Providing rich data is important, but equally important is the teachers' and parents' ability to translate that data into actionable and specific supports for each child. We offer virtual workshops and resources for parents, but quite frankly, this is a part that we want to continue to see growth in, more parent participation and our ability to meet their needs. We help programs improve quality while staying accessible to working families. Keeping the doors open and teachers in the classroom is imperative to families having access to safe, high-quality learning, allowing parents to go to work. We meet children, educators, and families where they are, and then together we build forward. As Simon Sinek says, we need to know our why. Our why is because by the time a child walks into kindergarten, your child, I think, is either just did or is going to be, their trajectory is already often set. And too many children in Central Ohio are starting behind, no fault of their own. Children who are not kindergarten ready are more likely to struggle academically, drop out of high school, experience under or unemployment, live in poverty, become involved in the justice system, and rely heavily on social services later in life, as we know, all at the expense of our community. I want to introduce you to Dr. Vanessa Turney, data guru, and amazing. She's going to share a quick update on some data.
Good afternoon. I am so excited to share some data with you. In the spring of 25, our organization put in a request with the Ohio Department of Education so that we could get access to our children's kindergarten readiness assessment scores. So theoretically, they would stay with us, we would screen them, and then once they graduate from our program and go into kindergarten, we wanted to know how well they were performing. We wanted to know if our screeners were predictive of their success in kindergarten. So I'm so excited to share that on Friday afternoon, we received our first batch of data. So you all are the first to hear about this data. Don't tell my boss that I'm sharing this with you so early. But as many of you know, that only 36.6% of children in Ohio actually demonstrate the scores that show that they're truly ready for kindergarten. And so with our children that we serve, we've learned that 54.63% of our children score the proficient demonstrating score, 29.63 at the approaching level, and 15.74 at the emerging level. This means that more than half of our children have entered kindergarten this fall fully prepared. Also, when we look at our readiness scores more broadly, we've learned that 75% of the children that participate in the Kindergarten Readiness Collaborative enter kindergarten on track as designated by the state. So that's 3 out of 4 of our children entered and were on track, and 25% are not on track, which means we still have work to do. This is exceptionally strong when we look at their readiness profile. But when we compare this to the state, the KRC students are 18.3 percentage points more likely to score proficient or demonstrating, and 20.5 points more likely to be on track than those of their peers at the state level. This shows a large, meaningful advantage for children who participate in our Kindergarten Readiness Collaborative. When we look more closely at the data and we zone in from the state level to the county level, we learned that our Kindergarten Readiness Collaborative children are 18.4 points more likely to score demonstrating and over 30 points more likely to earn an on-track rating. This is a dramatic difference in readiness. We also wanted to analyze the data for our student outcomes to previous year outcomes of children at each of the district our children will attend. And so when we look at each district and we compare our KRC numbers to the individual districts, the KRC exceeds every single district that our kids will attend, including Hilliard, which is one of the stronger performing districts in the county. So this literacy gap is even more striking because the KRC students are 20 percentage points higher than even the strongest district comparison, and we more than double some district literacy readiness rates. We also analyzed our data by subgroup. We think that that's truly important. Sometimes the numbers tell a different story when we look at subgroups, particularly when we look at the data for Black boys or Hispanic boys and girls. And so the data shows that the KRC is not only improving overall readiness scores, but is producing especially strong outcomes for students who are traditionally at the greatest risk of entering kindergarten behind. For example, the Black boys we serve are 37.6 percentage points higher than that of the state, and 223% more likely to demonstrate readiness for kindergarten. So there's a major equity gains here in this data. Our male Black students are outperforming their counterparts. This is one of the most powerful equity outcomes for our entire data set, so we want to celebrate that. The bottom line here is that our KRC students are entering kindergarten more prepared. We're delivering measurable results for children and the families that they come from. Our children are more confident and far more likely to enter those doors of kindergarten and ready to succeed. They are far ahead of the curve, and they outperform their peers across not only the state, but the county as well. And this is evidence of the impact, and it's not just by coincidence. Want to close it out?
Well, oh, sorry, go ahead.
Is it okay
Yeah,
just to wrap up
yeah,
real quick?
absolutely.
So when we talk about early childhood education, we are not just talking about children. We're talking about the workforce, the workforce right now, and the workforce of the future. Parents, mothers especially, I see a lot of moms or a lot of women in this room, are delayed entry into the workforce, reducing hours or leaving entirely because of childcare needs. Nationally, the economy loses tens of billions of dollars, as you all know, each year in wages, productivity, and tax revenue. Women are disproportionately impacted, which directly affects income, economic mobility, and employer stability. When children are in safe, accessible, high-quality early learning environments, parents re-enter the workforce or re-enter full-time workforce. They're more productive at work. They miss fewer days due to childcare challenges, and they stay in their jobs longer. Gonna skip on to this part, but the economists estimate that 7 to 13% of return on investment for every dollar invested in high-quality early childhood education through higher wages, lower incarceration rates, and reduced reliance on public assistance. If Central Ohio wants to be competitive and have a prepared workforce, investments must start early. The early childhood workforce itself, people like us every day, these people that are caring for our children, that are helping our children see these numbers that Vanessa was sharing with you, are often disrespected. They have lower wages, as Matt mentioned earlier. They have limited benefits. They have fewer career pathways and minimal investment in professional training and development. We invest in those teachers, 9 full-day trainings throughout the year, and pay them stipends and reimbursements to make sure that though they are getting paid on average $13.57 in the state of Ohio, it does help increase that pay. Sorry. Future Ready 5 exists because zip codes should not determine a child's ability to reach their potential in the classroom or your future boardrooms, or a parent's ability to find stable work. As you might have seen on December 7th, the cover article of the Columbus Dispatch titled "Parents Can't Afford Childcare," it showed that 66% of parents said that they had trouble accessing high-quality childcare, and 61% of mothers working part-time or not at all said that they would re-enter full-time work if they had reliable childcare. The time is now. The place is Columbus. We can't keep waiting for other communities to lead the way. We appreciate your time today. Thank you guys for the continued investment in our work.
Yeah, thank you both. And thank you for sharing that hot off the presses data. I think, again, as Aaron mentioned, my kiddos are heading off to kindergarten next year. And, just thinking about the amount of supports that so many families need, whether or not it's academic, social, emotional, just to keep kids in a safe setting to where they have the opportunity to thrive and be ready to go to kindergarten is something that I know so many great organizations such as yours are working with the city and others on. So thank you for keeping that mission front and center, and something that I know our Office of Education is diligently trying to, again, make every year their dollar go as far as possible to make sure that more kids have the type of opportunity that we know that they deserve. So appreciate you all's role in making that happen.
Thank you.
Did want to pause and see if any of the directors have any closing comments they'd like to make. Seeing none, I thank you everyone who came to the hearing, either testified or presented. Certainly all the city staff that helped to develop the budget for their respective departments or offices. And it is, always like to joke with the Workforce Education Labor Committee, the WELL Committee, it is about people. And, I think the budgets are obviously a reflection of what our priorities are, and appreciate our leadership here, making sure their priorities are reflective of either the people that call the city their employer, the folks that want to call the city their employer, or folks out in the community that rely upon the city of Columbus to help make sure that their kids have an opportunity to, again, be ready for kindergarten, have a safe place to go to school and grow and thrive. So with that, this committee hearing is adjourned. Have a good afternoon.